Yeah, all good to go. Yeah, thanks,
cool,
Ali.
perfect. Sorry. So what is social prescribing? So firstly, it's important to understand that the term social prescribing before we explain how it works in relation to the health system and patient care. It aims to support the individual to take greater control of their health. And as the definition explains on the slide, that it recognises that people's health and well-being are determined by a range of social, economical and environmental factors. And social prescribing looks to address and support individuals' needs in a holistic way. Social prescribing and similar approaches have been practiced in the NHS for many years, with schemes dating back to 1990s and some even earlier than that. The past few years have seen some important changes. Nationally, NHS bodies have embraced social prescribing and have committed resource to rolling it out across England. But it is also important to mention that anyone can social prescribe. You know, we can social prescribe. If you recommend a session or an activity to a friend or a family member, you are social prescribing. The ethos of social prescribing doesn't have to come through a medical referral pathway. So social prescribing is designed to support people with a wide range of social, emotional and practical needs. It is also known sometimes as community referral. And referrals generally come from professionals working in primary care, GPs, practice nurses, healthcare professionals, and they refer individuals into a range of non-clinical services, typically provided by voluntary and community sector organisations. And before we go any further, I just wanted to explain a little bit about the health structures locally and explain some of the terminology which you may have heard but may not necessarily understand how it fits. So firstly, this is Bristol, North Somerset and South Gloucestershire health system. It's referred to as the Integrated Care Board, so BNSSG ICB, so Bristol, North Somerset, South Gloucestershire Integrated Care Board. And as you can see, it's split into 6 localities or locality partnerships. So South Gloucestershire is the dark green colour at the top, and that is just one big locality for the whole of South Gloss. Bristol is split into 3 localities. So you've got North and West, which covers everything from sort of Lockleys out towards Avonmouth. You've got Inner City and East, also referred to as ICE. And then you've got South Bristol, which is everything from Knoll West, Bedminster, Hartcliffe to Whitchurch. And then down in North Somerset, the slightly lighter blue colour, you've got the Wood Springs area, and then One Western, Whirl and the Villages. And the locality partnerships work at local level with their communities to improve their health and well-being. Each partnership focuses on a given area and population and designs services that fit in with people's lives. Typically, they're made up of local health and social care and the voluntary sector, and that can include anything from GPs, council public health teams, social care, community services, mental health support, and local activity clubs. As you can see on the map, and it's not that clear, it's a little bit blurred, there is a breakdown of surgeries and GP practices per locality. And these surgeries have come together to form a family of surgeries known as a primary care network. And the useful slides link at the end of the presentation today, there is a great video from Herefordshire and Worcestershire, which explains a little bit more about PCNs and the services they provide. And then in terms of the health landscape for Bath and North East Somerset, so they are split into Bath, North East Somerset, Swindon and Wiltshire Integrated Care Board. And they are split into 3 localities, but they, rather than call themselves locality partnerships, they've classed themselves as integrated care alliances, but it is the same concept. And the 3 localities for that area is Bath and North East Somerset, Swindon and Wiltshire. So who can be referred to a link worker? So ultimately anyone can be referred to a social prescribing service, but typically do include people with mild or long-term mental health, people with complex needs, people who are socially isolated, and those with multiple long-term health conditions who frequently attend either primary care, so your GP surgeries, or secondary healthcare, which is hospitals. And research has found that an average of 28% fewer GP consultations and 24% fewer attendances at A&E where social prescribing services are working well. And that figure is probably slightly different now, as I appreciate that was March 2019. So how does it work? So it is estimated that almost a fifth of GP appointment time is spent on non-medical problems. And this can include loneliness, isolation, relationship issues, or stress relating to money or housing, which obviously at the moment with the winter that we've just had and cost of living crisis is a big concern to a lot of people. And social prescribing gives doctors and organisations and other other professions a way to help people address their problems more effectively. So typically, an individual would attend a consultation with a GP, or whether that's in person or on the phone, depending on their surgery, who may feel that social prescribing could benefit the individual as part of their treatment or prescription. The referral will be made to the social prescribing link worker, who will make contact, and that depends on the waiting times of the social prescribing service, so how many individuals they're supporting. They will contact the individual to understand their situation, provide them with practical and emotional support, and typically it's over 6 to 8 sessions. The number of months can vary depending on how many weeks are needed between actions or appointments. And obviously that 6 to 8 sessions can change depending on the individual and why the individual is being referred. The social prescribing link worker will then link them into organisations and sessions and information that can help improve the health outcomes of that individual. So what is a social prescribing link worker? Link workers can have a variety of different names, job titles, including health advisor, health trainer, care navigator, community connector, community navigator, social prescribing coordinator, and community care coordinator. So there's loads of different titles within that kind of brief and job description. But regardless of the difference in their title, they're all aiming to understand what matters to the person and to link them in with the appropriate support. So across Bristol, North Somerset and South Gloucestershire, link workers are either employed through the GP surgery or PCN themselves, or through community anchor organisations or healthy living centres. So the anchor organisation or the Healthy Living Centre are commissioned by the primary care network to provide the social prescribing service for their patients. There are also some new roles based within hospitals, so they are known as hospital link workers, and they are supporting with the discharge process, and also within housing associations. They do have link worker type roles now, which will be supporting their residents. And then in terms of signposting, so link workers will refer or signpost on to activities that are of interest to the individual following the what matters to me ethos of social prescribing. So it really is that person-centered holistic approach. What was the individual interested in the past? What do they enjoy doing? What do they not enjoy doing? And if you are offering sessions ready to receive referrals, there are a number of databases that link workers will use, including Wellaware, Better Health website for North Somerset, One New South Gloucestershire, and Live Well for Baines. These directories are a great place to promote your groups or activities, and we would recommend you posting on there. And it is really important that you do keep that information up to date. We know the problem with databases and directories, that they are only as good as the information that's on there. And there is never going to be, or not for a long time, there's never going to be that one platform that we all use all the time. But these are typically the ones that your social prescribers will go to. They do keep a list of services locally within their PCM footprint. So within their practices and GP surgeries that they are supporting, they will try and keep a real local list of things. That means that we're reducing barriers to participation in terms of access and transport. And they will refer to groups that they know have a good reputation or are referral ready to support individuals depending on their needs. And then what do we mean by referral ready? So most good providers will be doing most, if not all of this already. And it's about creating a friendly and welcoming space where deliverers are able to adapt to meet the needs of the participant. So for example, if you're working with a participant that's having a particular sort of health flare-up day, or if their symptoms are sort of stronger than other days, they still want to participate. So can the provider adapt the exercise, the activity, or the intensity to make sure that they are still included and part of the session? And then also, just because someone has been referred to a session by a social prescriber, they don't always, well, very rarely do they come with funding attached, and more often than not, they will be self-funding the class or activity themselves. There is a perception that individuals coming through social prescribing are unemployed or currently out of work. But in the current cost of living crisis, a large number of individuals are working 2 jobs to support their families. So exercise and funding activity will not be a priority. So low cost or nominal cost would be what we'd recommend. But also thinking about the time of day the session is offered as well. And if there is any training needs that clubs or providers need to be referral ready, then please feel free to reach out to us to see how we can support. And then in terms of the work that we're doing with the health system across BNSSG, we're currently supporting 5 physical activity link workers. The Bristol roles are known as wellbeing coaches, and we are working on a similar project across North Somerset. And the aim of the physical activity link work is to improve health and wellbeing outcomes for residents through movement, physical activity and sport. And these roles are there to provide signposting, they are there to provide guidance into the physical activity landscape, and they are that connect between healthcare and physical activity. You know, they're embedded within the social prescribing teams across Bristol and South Gloss, and they are already receiving referrals from healthcare professionals. And the idea behind their roles is so that they have a complete understanding of the sport and physical activity landscape across their locality. So for those of you on the call, if you do have sessions to promote that you feel can support individuals, then please feel free to email us with the opportunity, and we are happy to share with the physical activity link workers so they can keep adding to their map and their list of what provision is out there. And the reason we're doing it, this kind of gatekeeping method of signposting, is just so that the roles actually have the time to spend with the individuals they're supporting, rather than taking up too much of their admin time kind of going out and actively looking for these sessions. So as I mentioned earlier, here are a few of the useful videos explaining the wider health system. So the NHS commissioned the King's Fund to pull together a video around health and social care and how the NHS fits and how localities fit with hospitals and community provision. The National Academy for Social Prescribing have done a load of research into social prescribing and have developed some really great webinars on different themes within social prescribing and how it can benefit the individual across the life course. And then finally, the last video on the list is just around primary care networks. So as I mentioned, Hereford and Worcestershire have produced a really great video just explaining a little bit more about primary care networks and how it all operates. So that is kind of a whistle-stop tour and a real quick overview of social prescribing and how it works locally. So now is the opportunity for any questions. So you can either pop them in the chat if they haven't gone in already, or we can try and raise your hand and we'll try and get through as many as we can. If we run out of time for whatever reason, just pop your question in the chat. We can download the chat function afterwards and we can get back to you on an individual basis. So I'm going to stop sharing my screen so I can actually see everybody.
Yeah, I'm just going to stop the recording as well. So, cool.
Should we just ask?